My topic of discussion is on action potential. Action potential, which we can see in every type of excitable tissue. Every type of excitable can be in a neuron, it can be in a smooth muscle, it can be in a skeletal muscle, it can be in a fatty muscle. Now, if we look at the diagram of action potential, which is plotted on a graph. Graph is having y-axis and the x-axis. X-axis is indicating the time and the y-axis is millivolt. In this graph, we can see that the resting membrane potential means it is the potential across the cell membrane at rest. The resting membrane potential in a neuron becomes minus 70 millivolt. And this minus 70 millivolt, whenever we stimulate, then there is a development of action potential. And this potential, minus 70, is altered up to plus 40 millivolt. It cannot be plus 41, cannot be plus 42, cannot be plus 40. The maximum limit is up to plus 40 millivolt. And then again it is coming back. There will be a repolarization. This is the depolarization going up. Polarity of the cell is altered. Polarity becomes minus 70 millivolt. This polarity is changed to plus 40. That is why we are calling it depolarization. And then again is polarity of the cell is coming back. So that is why we call it repolarization. The total duration is 2 to 3 milliseconds. So here it is depolarization, it is repolarization, and this is quality of the polarization. Now, if we talk about a neuron, say this is the spinal cord. Then we have the sensory neuron, and this is the peripheral end of the sensory neuron. This is the peripheral end, and this is the central end. So this is the sensory fiber. Now, how we can look at the development of action potential? As we all know, if we just touch. Now, sometimes we cannot realize whether touch is there or not. But sometimes we can realize touch is there. If we are not able to realize, if we are not able to dictate the touch is there, then in that case, action potential is not there. Means what I am talking about, if little touch is there, little touch, then there is a channel which we call it leaky sodium channel. Leaky sodium channel is activated. Leaky sodium channel is activated, and we can see the changes in the potential. And these potential called local potential. This is local potential, or we call it graded potential. This is local potential or the graded potential. Or we can say it is excitatory post-synaptic potential. It is excitatory. Although we are not having the action potential, in this case, there is no generation of action potential. If you look at this graph 1, graph 2, there is no action potential. This is a local potential. Slowly, there is an entry of sodium ion. If little touch is there, we are not able to dictate, we are not able to realize whether touch is there. In that case, maybe there is a stimulus and maybe there is an entry of sodium ion, but there is no generation of action potential. All these potentials are called local potential or excitatory post-synaptic potential. Now, if we provide the threshold stimulus, then what will happen? The threshold potential is there, so the stimulus which is threshold, which will be able to stimulate, the another channel. That channel is voltage gated sodium channel. That is voltage gated sodium channel. And this voltage gated sodium channel will help bringing the potential from minus 60 millivolt up to plus 40 millivolt. So constantly there will be an entry of sodium ion through the voltage gated sodium channel. So that entry will be so fast. You can see here from this graph, within a few milliseconds, less than 1 millisecond, we can change the potential from minus 60 millivolt to plus 40 millivolt. Now coming to this plus 40 millivolt here, there is another line we draw here. That is the equilibrium potential. Equilibrium potential of sodium ion. Equilibrium potential, and that becomes plus 65 millivolt. Equilibrium potential. And here there is another for potassium ion. The equilibrium potential is minus 90 millivolt, or most correct value is minus 85 millivolt. That is the equilibrium potential. That is the equilibrium potential of potassium. Now what is the meaning of equilibrium potential? It is that potential where there is no movement of ion. That is the equilibrium potential. So here we can see that the equilibrium potential means there is no movement. If this is a cell, we are talking about the equilibrium potential of potassium. So there will be no movement. Potassium is generally going out. So there will be no movement of potassium in this potential, equilibrium potential. And plus 65 is the equilibrium potential. That is plus 65 millivolt. Means in this potential there will be no entry of sodium ion. Now in this graph, if you look at, as soon as there is a stimulus, the potential goes up to plus 40 millivolt. Why? Because we are talking about this sodium channel during resting condition. This sodium channel, this is the sodium channel. This will have two gates. One is activation gate and another is inactivation gate. This is the diagram you can see during resting condition. Resting condition means when the voltage becomes minus 70 millivolt. In this case, this is the diagram of the sodium channel you can see. Now as soon as the potential goes up to minus 60 millivolt, means the potential is altered, goes up to threshold potential, then this channel is activated. What should be the structure of this channel at this time? So this is the sodium channel. This will remain same. Inactivation gate will remain same. But instead of this will be opened. This activation gate will be opened as soon as this becomes minus 60 millivolt, because this is the voltage rated channel. So once this is opened, then there will be an entry of sodium ion. Now this entry we can see up to plus 40 millivolt. This entry, as soon as it is going nearer to plus 65 millivolt, generally we know that movement will be less. So before that, according to the characteristics of this channel, this gate will be closed. This gate will be closed. Which gate? As soon as the voltage becomes plus 40 millivolt, then this is the diagram, plus 40 millivolt. Now, which gate will be closed? This will be closed and this will remain active. Inactivation gate will be closed as soon as the voltage becomes plus 40 millivolt. Now this is the status we can see during resting phase, and this is the status we can see during active phase, and this is the status we can see during inactive phase. So the channel structure, if we look at, this is resting, this is the structure you can see during resting membrane potential. This is the structure you can see when the membrane potential becomes threshold potential. Then as soon as it goes up to plus 40 millivolt, then this gate gets closed. That is the inactive state of the sodium channel. Inactive state, this is the resting state and this is the active state. Now, as soon as this is closed, there is another gate is opened. There is another gate is opened, and that is the potassium channel. In this, as soon as this becomes plus 40 millivolt, this is the potassium channel, and this channel, this is the inactivation gate, and this is the activation gate. This is activation gate, and this is the inactivation. So in this, there will be an exit of potassium ion. So this is the state we can see when the membrane potential becomes plus 40 millivolt. In this case, there will be closing of sodium channel and opening of potassium channel. So this activation gate remains open. This is opened, and this is the resting state. This is the resting condition. You can see what is the resting structure of this potassium channel. This is the potassium channel, and this is the resting state, and this is the resting stage. This is the resting stage of potassium channel. This is the inactivation gate. Sorry, this is the activation gate, and this is the inactivation gate. Now, as soon as this becomes minus 70 millivolt, then slowly, once this volt is nearer to equilibrium potential, so the exit of potassium will be slow. Now, in this case, the movement, since the movement is slow, then gradually also the potential becomes negative, and ultimately after a few milliseconds, 1 millisecond, this will come to the normal condition due to involvement of sodium, potassium, ATPase, as well as leaky sodium channel and the potassium channel. This structure of the sodium channel and the structure of the potassium channel will come back to its resting state. This resting state has to be brought, then only this will fire again. Otherwise, this cell cannot be activated. Now, once this is generated, this can be moved. Once here it is generated, this can be moved from one place to another. How? Already we have come to know that this sodium ion entry will help to stimulate the voltage gated sodium channel, which is near to this. So what will happen? There will be entry of sodium ion. Again, this will help the sodium channel, voltage gated sodium channel, which is nearer to this. So like this way, we can see the movement of action potential from one place to another place. Now, coming to the differences between local potential, and action potential. What is the difference? Local potential can be graded potential. This can be a graded potential, and this is not graded potential. Means what I want to say is, here the gradation is there, means the amplitude can be different. The amplitude is less amplitude than this amplitude. So amplitude is different. But here the amplitude will remain same. Means if we talk about action potential, the action potential always this will be altered from minus 70 to plus 40. So the amplitude everywhere will remain same, but in this case the amplitude remains different. That is the graded potential. Then the time, here the time is different. Total time also can vary according to their status of stimulus, according to the nature of stimulus. The time can vary, amplitude can vary, time can be varied, but here the time also will remain constant. So the second point is the duration. Duration here can be altered, but here the duration remains same. Duration remains same. Now there is another is this follow all or none. Action potential follow all or none. This follow all or none means if the stimulus is threshold or suprathreshold, then the cell will respond. But here this does not follow all or none. This does not follow all or none. Means if small stimulus is there, accordingly the response will be there. Little larger stimulus, strength little, if we improve the strength of stimulus, then the amplitude will be there. So here all or none principle is not applied. All or none principle is not applicable. Then auto-propagatory. Auto-propagatory means this action potential is auto-propagatory. This is auto-propagatory. But here auto-propagatory means once it is developed, once action potential is developed here, this will go. But here, this will not go. Once it is developed, this will die here. This is developed, this will die here. This will develop, this will die here. But once the potential is reached up to threshold, action potential will be generated and will be moved. So these are the basic differences between local potential and the gradient potential. Now another important aspect of action potential is refractory period. If you draw a diagram, so this is the y-axis and this is the x-axis. This is the plus 40 millivolt and this is minus 70 millivolt. This is 1, 2, 3. This is millisecond. This is the duration and this is the volt. Millivolt. This is the millivolt. Now here the refractory period. If we talk about the refractory period, it is two types. One is absolute refractory period and another is relative refractory period. Absolute refractory period and the relative refractory period. The absolute refractory period up to this first two-third period is coming under absolute refractory period, and the rest is the relative refractory period. How we can explain absolute refractory period? It is the period of quiescence. Means in this period, if we provide another stimulus, the cell will not respond. Respond means there will be no generation of action potential. But in this, if we provide the stimulus with larger strength, we suppose the strength of stimulus here is 5 volt. 5 volt. Now if we increase the strength of stimulus here 10 volt, then only we can see the response. Means if we want to have the response here, then we have to increase the strength of stimulus and it should be more than the first stimulus. This is the first stimulus, if you say it is the first stimulus and the strength of stimulus is 5 volt, then in this case, if we want to have response, then we have to make it double or we have to increase the strength of stimulus and that should be 10 volt and then we can get the response. So that is according to their nature of response, according to their characteristics, it is divided into two. One is absolute refractory period. In this period, if we provide second stimulus, the cell will not respond. But here, in this case, if we increase the strength of stimulus, then we may see the response during this period. In this last 1/3 period, if we provide the second stimulus, then with larger strength, then we will have the response. This experiment we can do it easily. We can lab if we have living tissue. Living tissue means if we have frog, gastrocnemius sciatic nerve muscle preparation is there. If we prepare that gastrocnemius sciatic nerve muscle preparation, and then if we have chymograph and other related instrument, then we can easily see the response if we provide the second stimulus. If we provide the second stimulus with the same strength, we will not have any response. But if we provide the second stimulus with a larger strength, then easily we can have the response. We can record easily in our laboratory. Now coming to the cardiac muscle. This graph already we have gone through action potential. This can be in neuron and this can be in skeletal muscle, same graph. But in cardiac muscle, the graph is little different. Means here the graph is looking like this. Here it is minus 90 millivolt, and the duration becomes 100, 200 and 300, that is millisecond, and it is this side, this is plus 40 millisecond millivolt, that is the strength, that is the y-axis, and this is the x-axis. And the phases, if we talk about, this is depolarization, this is depolarization, this is repolarization, this is depolarization, and this is plateau phase. This is the plateau phase. Repolarization. Now, this is positive output hyperpolarization. So, if we make the differences of action potential recorded in skeletal muscle and cardiac muscle. In skeletal muscle, the duration is only 2 to 3 milliseconds. That is the action potential we can have, and the total duration is 2 to 3 milliseconds. But here it is 300 milliseconds. Means the process in cardiac muscle becomes slow. Now the phases, here also we have depolarization, and we have positive after hyperpolarization. Along with, we have another phase, that is the plateau phase. So in this plateau phase, we can see the entry of not only sodium ion, but there will be an entry of calcium ion. Along with, there will be an exit of potassium ion and entry of calcium ion. Because the muscle fiber, cardiac muscle fiber, do not have extensive arrangement of sarcoplasmic reticulum, do not have adequate amount of calcium ion in systole. So this cardiac muscle fiber needs calcium ion from extracellular space. So in this period, it is that period where there is an entry of calcium ion from extracellular space. Looking at the smooth muscle also can be drawn graphically. So here this is plus 40 millivolt, here it is minus 60 millivolt. The duration it is 100, 200 and 300 milliseconds. Here also we have depolarization. Here we have repolarization. And here we have this plateau phase. So the resting membrane potential in smooth muscle becomes minus 60 millivolt. And here we have the threshold potential, and that is minus 40 millivolt. That is the threshold potential. Here also we have a similar type of phases. We have depolarization, plateau phase, repolarization, and positive after hyperpolarization, just like cardiac muscle. And the duration also remains same, but the only big difference which we can see here that the resting membrane potential in smooth muscle is minus 60 millivolt. Now, if we come to the specialized conducting tissues of the heart, then this becomes different. Here, the specialized conducting tissues, cells of nodal cell, if we talk about the cells present in the specialized conducting tissues of the heart, that is nodal cell, and the resting membrane potential is minus 60 millivolt. Now here, if we talk about the depolarization and repolarization, here we have the leaky channel, leaky sodium channel. Actually, this is called honey sodium channel. The name of the sodium channel is honey sodium channel. This honey sodium channel, if this is the resting membrane potential minus 60 millivolt, then here also we have 100, 200 and 300 millisecond. Now, once it is the honey sodium channel, then there is a entry of sodium ion. As soon as there is a stimulus, there will be entry of sodium ion, and that becomes, say, it is minus 55 millivolt. So little positivity you can see, or the negativeness of the value, negativity of this value will be turned towards positive. Say it is minus 55 millivolt because of this honey sodium channel, and then this will help to stimulate. The threshold potential is minus 40 millivolt. So this will stimulate. So there will be more sodium ion inside. This will stimulate the calcium channel. So there are two types of calcium channels. One is P type and another is L type. So there are two types of calcium channel. Now this entry of sodium ion will stimulate the P type of calcium channel. So there will be an entry of calcium ion. And resulting this minus 55 will be changed to minus 40 millivolt. So it will be minus 40 millivolt because of entry of positive ions, calcium ions, positive ions. So this minus 55 will be changed to minus 40 millivolt. Means the threshold potential is coming. This potential is coming, changing up to reaching up to a threshold potential because of entry of calcium ion. And this calcium ion will help bringing potential from minus 55 to minus 40. Then this will help to stimulate another channel, that is L-type calcium channel. This is the first channel, and this is because of this the potential will be changed up to plus 40 millivolt, and then up to 40 millivolt. Then there will be an exit of voltage gated potassium channel. So it will come back to minus 60 millivolt. Now here there is no positive after potential, positive hyperpolarization. See again, I will repeat what I have said. The nodal fiber or the pacemaker fiber, the resting membrane potential is minus 60 millivolt, and this minus 60 millivolt, that is the resting membrane potential. And once there is a stimulus, or automatically this is the specialized conducting tissues of the heart. So what will happen? There will be a first stimulation of honey sodium channel. This honey sodium channel will bring the potential from minus 60 to minus 55 millivolt, and then this will help to stimulate P-type calcium channel, and this minus 55 will be brought to minus 40 millivolt, and this minus 40 millivolt will stimulate the L-type calcium channel. So this L-type calcium channel is the first channel. So gradually there will be potential change from minus 40 to plus 40 millivolt, and then this will help to stimulate the voltage gated potassium channel. So it will come back to minus 60 millivolt. So in this case, this is specialized because in this case we have honey sodium channel. This honey sodium channel does not need any type of stimulus. Automatically this will be stimulated as soon as this becomes minus 60 millivolt. So once in minus 60 millivolt, there is a stimulation of honey sodium channel, This will be minus 55. This minus 55 will stimulate the T-type calcium channel. So this T-type calcium channel will bring the potential up to threshold potential, and this threshold potential, once it is threshold potential, then there is a stimulation of L-type calcium channel. So there, so the potential will be altered, will be changed, will be depolarized, and that will be reaching up to plus 40 millivolt. And this plus 40 millivolt, due to the involvement of again voltage gated potassium channel, will come back to minus 60 millivolt. So this way we can see the spontaneous generation of action potential till death. So spontaneous activity we can see with the nodal cell. And this nodal cell, we have a contractile cell. There is another small information I would like to add. This nodal cell is connected with the contractile cell to the gap junction. So this nodal cell is connected to the contractile cell to the gap junction. So whatever the changes here, these changes, say here it is minus 60 millivolt because of the entry of minus 60 millivolt, it changed to minus 55 because of the entry of funny sodium channel. So here also there is an entry of sodium channel, and this sodium channel, this change is minus 55 millivolt. Again, what I am talking about the entry of calcium ion. So here also there will be entry of calcium ion. So ultimately there will be stimulation of L-type calcium channel, and here also we can see the generation of action potential in contractile cell. This is the nodal cell and this is the contractile cell. But in this contractile cell, this is minus 90 millivolt and here this is plus 40 millivolt. This is the plateau phase. This is depolarization and this is repolarization. So whenever there is a spontaneous generation of action potential, we can see nodal cell. The same type of activity we can see with the contractile cell, and heart can go for contraction followed by relaxation. This is the contraction, this phase is the contraction, and then followed by relaxation.